Hi, this is Dr. Grace Chen. I'm a licensed marriage and family therapist and MGR approved EMDR consultant. In the past 2 years, I have facilitated 85 EMDR basic training consultation groups and over 50 EMDR certification groups. So I conducted a qualitative research using my own EMDR basic training consultation group notes and identified the 10 most frequent asked questions from my trainees. This series of short videos are designed for the beginning EMDR learners who start out to incorporate EMDR into their clinical practice. The eighth commonly asked question is that my client's trauma is so complicated. How should I prioritize the target? Where should I even start? The short answer to this question is what are the client's goals for therapy? This answer sounds simple but very complicated to answer. During the basic training, we often taught trainees to identify the issues clients want to work on and then use that as the recent events to flow back to identify the maladaptive memory network. However, when clients have complicated issues, identifying one specific issue, specific trigger or symptoms might be impossible. Often the issue, trigger, and symptoms are intertwined and difficult to identify. At the same time, many clinicians also want to rush into the phase 4 reprocessing. They often start reprocessing based on the trauma memories shared by the clients instead of mapping it out based on the treatment goals. At the end of reprocessing, the clinicians are confused as to why they process these memories and what to do next. My first strategy is to identify different clusters of the issues. For example, the issue might cluster around anxiety, such as obsessive thinking, predicting the future, and anger outbursts. Interpersonal relationships, such as people pleasing, difficulty setting boundaries, and specific issues, such as finances, academic performance, or marital issues. Then I try to identify how the presenting issues interact with each other to create a vicious cycle or a pattern that keeps the client stuck. So, for example, a client's presenting issue might be a marital problems with the significant other, obsessively worrying about the communications or interactions with the significant other, and placating the significant others while frustrated and angry at the significant other for not returning the same favor. So I put a pattern together and shared it with the client to confirm whether my observation is accurate. Based on the discussion with my clients, we will develop a plan for which issue to tackle first in order to break down the vicious cycle. For example, the client and I might decide that people-pleasing behavior causes the obsessive worrying, difficulty setting boundaries, and anger outbursts. Therefore, we will start the recent experience of people-pleasing to flow back and find the memories in this maladaptive memory network. Often emphasize the importance of identifying maladaptive thoughts, behaviors, and emotional responses in the recent situation, and then using the somatic experiences when thinking about these thoughts, emotions, to guide to return to an earlier memories, which often help the client can find pretty earlier ones. And then I can use the present day issue to find the past trauma memory to reprocess the very first one, the worst one, and then after that, I will check whether there are disturbances still in the past, any other past trauma memories still have disturbances. And if not, come back to check if there are disturbances in the present day experiences to decide whether I need to reprocess the present day issues. And then we can build a future template, and that's how the three prongs are connected, which is use the present day trigger issues, flow back to the past trauma memories, process at least first and then worst two traumas, and check if any other trauma memory is still disturbing, and then come back to check if there's disturbance of the present day issue, and then build a future template. So once we are done with the most significant present day issues, then we can continue to explore the second most significant issues in the vicious cycle, such as setting the boundary, and then do the same treatment planning and reprocessing. One of my consultants used to describe this process like remodeling the house. You want to start with the area in your house where it will give you the biggest bang for the buck. Then you move on to the next project in the house. Similarly, you start with the biggest one that can break the vicious cycle and then do the treatment planning and then reprocessing past and present, and then build a future template, and you move on to the next one.